Hi, my name is Suzanne Robidoux. I'm originally from Montreal, Canada, and I started studying medicine through the Western medical system in Montreal, Canada. And I was very dissatisfied by the way the Western medical system treats all patients with the same protocol, the same treatment protocol, even more dissatisfied by the results. And so I stopped Western medicine, and at the time I've already started martial art training. And so I knew a little bit about the energy world, but more of a martial arts stance. Then I moved into Chinese medicine, and I did a master's degree in the US, so it was a 4-year full-time degree. And it was very interesting. The philosophy was very interesting. I also continued martial art training at that time, but I found that there was no link in the actual clinical application of Chinese medicine. And so I graduated in '99, and in 2000 I decided to move to China, well, originally to Taiwan, to see what the Asian world had to offer, because at that time there wasn't a lot of resources for Chinese practitioners. And so I moved to Taiwan, I learned Chinese, I figured I need to communicate with these teachers, and I needed to find a link, you see, between the energy world that I felt in the martial art within the medicine. And so I found a few good teachers in Taiwan, but I felt like I needed more of a medical aspect to it. So then I moved to China, to Nanjing, and I did a PhD. And I thought within the 3-year full-time PhD I would find my answers. And I did find some good teachers. But when it came down to clinical practice, I found that it was still the TCM aspect. And there was still this kind of protocol. The Western medical system of each patient, each syndrome has the same protocol. And it wasn't so related to the understanding of the energy. And so after I graduated in 2007 for the PhD, after that I just decided to go around China and find teachers. So if I would find a teacher that had a good reputation for getting clinical results, I would go and just do clinical practice with them. And since I had the language, it was a lot easier. And through that, I really feel like going through the medical system, the schooling system, gave me a portion of the information, but really finding those teachers that has kept clinical practice either through their family lineage or through their teacher lineage, I found that brought a lot of richness to my clinical practice. And so I really would like to encourage people that are interested in Chinese medicine to, yes, learn the TCM and learn all of the basic information of Chinese medicine, but afterwards it's really important to go back to the classical text, and not only the text but the application of the information that we find in the classical text. I find that changed my clinical practice, and it brought back the faith in Chinese medicine in a way as well. And so it's a good approach to take, to go back to the roots and bring it back to the clinic that we have today.